everyone. You're listening to Achieve Balance with Dr. Arminta, a show brought to you to help you be healthier, happier, and more vitalistic next year than you are this year. You can find us at achievebalancechriropractic.com/podcast. And you can find us on Facebook as well. We are looking forward to helping you be healthier in your future. Thanks for listening. Now let's start the show. So welcome back to Achieve Balance with Dr. Arminta. I have with me today Dr. Sally Ellebracht, and I cannot even tell you how excited I am to share her with you guys. She, in my opinion, is one of Mid-Missouri's hidden gems, and she might not be hidden for too long, too much more, because she's just doing amazing things here. She is out of Boonville, Missouri, so she's an integrative medicine doctor, and we are going to talk today about what led her to where she's at, what she does, what is integrative medicine, and how can it help benefit you, because this is all about you being healthier tomorrow as opposed to today. So building healthy habits to the future. So welcome to the show, Dr. Sally.
Thank you, and thank you for inviting me on.
Absolutely. So tell us a little bit about let's talk about what is integrative medicine to you, because some of our listeners might not understand the difference between our traditional medical model and integrative medical model.
So the view that I have of integrative medicine or functional medicine is getting to the root cause of problem that people are having or a disease process or processes. And it's integrating not just conventional medical knowledge, but also knowledge from complementary type of medications, or what some people would consider alternative, which I think it should be integrated together into a holistic picture. So at times I will work with chiropractors, acupuncturists, massage therapists, and try to work together as a team to try to help our patients achieve feeling better.
I love that. So how long have you been here in Boonville for?
So I grew up in a small town near Boonville called Pilot Grove, Missouri. It's a town of about 750 people out in the country. I then moved to Kansas City to go to medical school, then moved to Clinton, Missouri, and had a practice there for a while. And then we moved back to Boonville in 2009. So in 2009, I was at the hospital clinic for about 3 years, and I've been here in my new location for 5.5 years now in my own solo practice.
That's wonderful. So tell me, what got you into functional medicine or integrative medicine over the traditional model? When you went to med school, did you always know that that's the way you wanted to do it?
Not necessarily. We had a family friend that was a chiropractor, and it was always interesting the things that he could do to help us. I remember he had a supplement that was an immune system booster. And I remember that when I took those vitamins, I didn't get sick, I didn't realize at the time how invaluable that was until looking back and reflecting on that recently. When I went to medical school, I originally wanted to be an emergency room physician. I liked the excitement and the variety of things. And then I realized what I truly loved is getting to know my patients and their families. And so I chose family practice. And so I was a traditional, classically trained MD that then went to residency for 3 years, the standard 3 years for family medicine. And during that time is when I really got introduced more to integrative medicine. I had many teaching doctors, but one that really sticks out in my mind, Dr. Carl Davis, was doing a lot of research on insulin resistance, which at that time was a very unknown, but yet very powerful. And through him, I learned a lot about my own medical issues as well, and was able to do more a teaching month with him where I helped do more research and wrote papers and that sort of thing on insulin resistance, which in turn turned out to be a huge impact in my own health. And so seeing that change that it made for me, I credit him with a lot of introducing those type of concepts in my brain. Then when I got out of residency or graduated from residency, I went into more of a traditional model of family medicine and started having children and raising a family, and continued to keep in mind the insulin resistance and inflammation, and grew on that some. And I probably didn't accelerate in my thinking of integrative medicine until about 2010, when I started seeing and realizing and reflecting and looking back at all of the patients that I had seen and how many things there were that I didn't know how to fix. And I found that my sort of bag of tricks of what I could do to help people feel better was so limited. And at first it was a little discouraging. All that time and all that training, I learned so much, but yet there was still more out there. And I happened to have a patient that brought me a book by Dr. Hotz, Hotze, that talked about hormones and thyroid and all of these things that personally I had struggled with some in my own health. But I had a patient that really wanted me to read this and see what I thought. But she thought that it almost sounded too good to be true. So it sat on my shelf for a while as life gets busy. And then one day I picked it up and I read it from cover to cover within an hour. It was fascinating. This doctor brought all of these things in perspective that I had never had seen before. So that was truly enlightening, and that started my journey with the bioidentical hormone therapy, and then in turn with functional medicine, where you try to get to the roots of the problems.
That's awesome, because that's really, if you don't get to the cause, you'll never really get to the cure. We just adjust the symptom, then we're never going to get to the actual correction of the problem. So when you were talking about insulin resistance, I'm going to take this a little sideways, because I love our patients to know about you, but let's teach them some stuff too while we're here.
All right.
So, we have, you were talking about insulin resistance, and then you said inflammation. Let's talk about inflammation, because from my observation as a practitioner, that is our precursor to everything. And so if we can get your body to be non-inflammatory and not producing all this extra inflammation and mucus, then your body will be in more of a state of ease, and your body won't want to end up self-attacking itself, like in autoimmune issues, or cancer is in portions of the body just getting out of control where it can't function. Heart disease, diabetes, all of those are linked to our inflammatory responses. So what are some of the things that you tell for your clients and your patients? What is some of the best ways that they can do to control their inflammatory responses?
Well, that's a good question, and a very broad topic.
Very broad, super broad, and we can paint broad strokes, because when we do this here in this sitting, we have to go broad. And once we go broad and you can start to get some habits with that, and you're not seeing an improvement, this is when you start to come and see your wellness experts. You see the team of wellness people like Dr. Sally, like chiropractors, like ourselves, you see them so that they can help guide you, because it takes a team to be well, just like it takes a team to manage disease. So tell us about what are some broad stroke stuff for inflammation to get people off the jump.
I'd say the biggest cause of inflammation is diet, number one. And things that may cause inflammation in your diet may surprise some people. We're very misled, I believe, in what is a good diet.
Very much, I agree, 110%.
So very broadly speaking, I think in general, not sugar, no high fructose corn syrup, processed food. If you stick with a diet that's rich in whole food and a variety of foods, so your protein sources, and not just what you're eating as far as a protein source, but what your protein source eats.
Yes.
So there's a big difference between beef that's grass-fed versus beef that is mainly corn-fed and in confinement.
Very, very different. We actually just interviewed David Boatwright, who is in your neck of the woods, that he does grass-fed beef and lamb and just amazing. And we talked a lot about that. And so people don't understand that it's important to know you are what your animal eats, not just what you eat.
And as strange as that may sound at first on the surface, hearing this maybe for the first time, there's a specific book that I wish I could recall the name of right now, that was written by a cardiologist, well, several cardiologists, in fact.
We'll figure out the name of the book and we'll put it in the show notes. So just so you guys know, we'll tuck it in there and we'll make sure that you get the name of that book, because I know that we'll figure it out between the two of us talking about it.
Oh,
after the show,
absolutely,
for
absolutely.
sure.
Sometimes the library is so big, it's hard to remember every book.
Always.
But basically, the difference is you have the grass-fed beef that is high in conjugated linoleic acid, which is a type of omega acid. You know, we are omega fatty acid. We always think of fish, especially the cold water, wild-caught fish like salmon, for example.
Right.
However, we don't really pay a lot of attention to the conjugate, the CLA. And that's really important too in our overall anti-inflammatory type of diet as well. And a diet that's rich in vegetables and trying to stay away from a lot of the synthetic grains and the overprocessed grains makes a really big difference too as far as inflammation. Chronic stress and how we deal with chronic stress. And there's a difference. There's really good stress. There's the stress of conquering the mountain, so to speak, and then there's the stress of the inconquerable mountain. And so we have to be able to take a step back and be able to evaluate, is this something that you can conquer and it's worth it, or is it something that will never be conquered and is not worth it in our day-to-day lives? And I do think that in general our day-to-day lives are so hectic and so stressful and so busy that we tend to just try to survive the day instead of enjoying the day.
Absolutely. It's an epidemic, I believe, that's happening in our world right now. It's just the go, 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 that we're going to all get to the point of the end of the road, per se, and go, oh my gosh, I forgot to really experience it.
Mm-hmm.
I'm so busy that I forgot to experience it. And that busy is, if we let it consume us, can create that chronic stress and then create the inflammation. Sometimes when you do that so much, your body gets pushed into a point where it has to slow down. And I think it's better for us to be conscious about it or mindful of it to slow down before our body wears out and makes us slow down.
Exactly, which can be easier said than done, and is something that you have to practice and exercise just as if you were training for a marathon.
Absolutely. It has to become consistent. There has to be consistency with it. And so just doing it, repetitively, you might not be good at it at first, but over time, I think that we all get better at the things that we practice. And as long as we're gentle with ourselves along the way, I think it's a really powerful, powerful tool.
So those are I would say the most broad things that I can think of as far as inflammatory causative agents type of thing. And we identify in many factors in medicine things that inflammation causes. And in general, you just feel terrible when you have inflammation. You hurt, you have brain fog, you feel tired, you don't sleep well. Your body was made so resilient and so amazing in so many different ways, yet we don't treat it with the respect that it deserves a lot of times.
Very much so, because we're never trained to. We're trained to have that. We take it for granted almost. Like we just assume that it's always going to take care of us. And then when it does start to break down, we talk about the age factor. And I think that the age factor plays much less of a role in our actual body breaking down than chronic stress factor plays in our body breaking down. Our bodies are meant to last a lot longer than what they're actually being, and what we're actually living to right now.
Exactly. And we're starting to see a trend where life expectancy is starting to go down, which to me is very alarming.
It's hugely alarming. I completely agree. It's the first time actually in recorded history that our children's life expectancy is actually shorter than our life expectancy. And that's why we're doing this podcast. That's why you're in practice. That's why I'm in practice, because something's got to change the needle to ensure that people start to honor that innate intelligence that's within us and give our body what it needs to remove the toxicities that it doesn't, and has professional guidance along that route so that you can have somebody that helps oversee and help steer your ship, because we need guides, we need Sherpas, if you would, to take us up the mountain, the conquerable mountain, that you can get healthy because it is worth it. I think that that's really a powerful, powerful thing. So your practice here in Boonville, you're a family practice doc in general. So you see things from children, colds and flus, to stitches here and there, to, oh my gosh, Well, I know that I send patients to you all the time for all sorts of good stuff. And they always, the women that I've sent to you, Dr. Sally, I could cry. It's so good. Like, it's so good. You have given some people back just watching them fully transform has been like one of my most recent, just greatest joys. So I just thank you as a side note for that.
You're welcome.
That is,
that's wonderful to hear.
oh my mercy, get emotional talking about it because you're going to see the light come out of people when they didn't have light when you met them, and it's just so powerful. So, what is your favorite stuff? Because I mean, we all as doctors, we all have kind of like our thing. I go, what's our favorite stuff that we really want to work on? I know I have my favorites that I like to work on.
Well, as you mentioned, I see a broad range of things, and I certainly there are so many favorites. I would have to say one of my favorite conventional doctor things that I love to do. I love to sew things up. I love to do stitches. You have a big nasty laceration come in and you can sew it up and look so nice at the end. So that's a rewarding part and a very fun part too, although maybe a little bit gruesome at times, but I handle that pretty well.
You grew up on a farm, right?
Exactly. We talked about worse stuff like this at dinner table, fortunately. But I'd say my passion right now is the functional medicine integrative approach, where I can see that patient that may think that they don't have any hope to feel better, and to be able to sit there and tell them and look them in the eye that we're not going to stop until they feel better, and give them that reassurance. And it is not false reassurance. I don't like to give up. I don't. And there are so many things that can be done to empower people to start feeling better. And I feel like that's what I'm driven to do. So I love to see those inconquerable cases, those cases where they don't feel like there's any hope left and they've had every test done in the world, to be able to sit down with them and to be able to timeline and go through when they started and how they started, to be able to then be able to string everything together in a picture that they can see very clearly. Then we do some additional testing and other type of things, and constantly along the way be their cheerleader and like you said, their guide. So I'm helping them, but I feel like the majority of their change is them and what they do. I'm guiding them along the way. And that is the cool thing, is in the past and with more conventional medicine, it's you're handing out medication to control a number, like say the blood pressure. Not that that's not important. I'm certainly not saying that, but then they feel like their health is reliant upon that medication, and it's not in their power. And most of the time, even when you get that number down to a quote unquote normal number, they don't feel any better. And then it's not long later and they come back and they have another issue that's treated separately, when the underlying issue, if it was addressed, they wouldn't have had more issues. And I think one of the points of my career I started seeing is when I had patients on multiple, 2 or 3 pages of medication, and they would look at me and say, I had one man that told me, he said, all these medicines I'm taking and all these procedures I had done, you think I would feel like Superman. And he said, and looked me in the eye, I don't. I feel terrible.
By that time, you're giving medication or you're receiving medication for some side effects of the other medications that you're taking, and then it just becomes a complete perfect storm for the body to not be able to adapt at all. And talk about chronic stress. I mean, that medication is stress on the body. Yeah, it will divert a pathway. It will change a symptom. And yes, sometimes it is very necessary, and thank God for it. But it is never the thing that makes them healthy. The thing that makes them healthy is always on the inside. And like learning about that is powerful, and giving them the keys back to their journey and giving them hope, because I think that is a lost thing in our air quote healthcare system. Is people are stripped of hope all the time, and I think that having that in your brain puts a barrier between you and actually receiving healing. And I know that sounds woo, but it's proven. it is proven that if your brain doesn't, if you don't believe it, then you're not going to receive it. It's really an interesting phenomenon.
I think a lot of times we're discounted that we don't have the control over ourselves and over our bodies when it starts to malfunction. And there's very few times that that's ever the case. Maybe need a little extra help at first, but then always you need to be able to feel like you have that power of control to be the change in yourself too. And I truly believe that we were created that way.
I completely agree with that. Like, it's already built into the system and the healing capacity of the body. As long as you support that intelligence and, give the body what it needs and make sure that you're guiding it in the right direction, then it will heal. It will take time, but it will heal. I think that those are things that most people just don't really grasp onto. When you're stuck in the minutia of it, like when you're really, really sick and you really don't feel good and you haven't felt good or been like that for years, it would be really hard to be able to see over the hilltop. So part of what you do is you help them see over the hilltop and find that there's a path, there's a way with that. I know a lot of our patients that we send you, we are dealing with a lot of hormonal imbalances and hormone issues going on there, from thyroid to female reproductive hormones, which they're all tied into one another, obviously, but depending on the symptoms that are showing up. What got you really involved in the thyroid aspect and the hormonal aspect? Because you were very talented in that arena.
Well, thank you. I'd say the thyroid started as a personal interest. I was diagnosed with thyroid issues when I was 16 years old. And so I was always interested in trying to feel better. And I remember feeling the feeling of this must just be as good as it's going to get, until I started learning more, just a little bits here and there about thyroid issues, and realizing that the way that I was having my thyroid treated and treating myself, there were so many other things. And so that opened just a whole, and once you start opening this new world, or as I like to say, you're making the box bigger. You're not thinking outside the box, you're making it bigger. Then you start seeing more stuff and more stuff. It just builds and builds and gains momentum. And I tell you, when I'm the excited and even the most fulfilled at work is when I'm learning something new, which is happening quite frequently. And then you can start to expand on that even more. And so along my journey, my personal journey with my thyroid, the more stuff that I've been able to do for myself and help myself and see the difference, I want to pass that along. Because now all of a sudden, instead of feeling like, well, I guess this is just how I'm supposed to feel. And I hear that comment a lot, or I guess I'm just getting older and I have to accept that. And that is absolute bunk as far as I'm concerned. Everybody has a capacity to feel good. And everybody knows what that feels like. And I think a lot of people lose sight of that and lose that sense of well-being and that everything is okay, but yet they don't know how to express it, because it's an internal, it's in your brain. You know it, and you know when it's off, and you know when it's right. And so that was one thing that really inspired me with the thyroid issues. When I was early on in my practice, I was the only female in my practice. And so I saw a lot of women, a lot of my partner's patients for well-woman exams and that type of thing, just feeling more comfortable with a female. And so I compiled quite a list of different symptoms that they would have when they were going through hormonal changes, or even preconception, having issues with fertility, and just, going through those type of heartache-inducing things. And when I started learning a little bit more, and I was in the realm of time where at first, when I was in medical school, every woman went on hormones. Estrogen was the thing. If you had a uterus, you had to make sure and take progestin, or what we said progesterone, but it was progestin, which is a copycat progesterone that's completely different than progesterone. And then when I went to residency, a big study came out, and nobody should be on hormones anymore. It's terrible, awful, nobody should be on them. And so that black and white picture, if hormones were terrible for us, why were we, first of all, created to make them? And why aren't more people sick when they're teenagers, when they're making lots of hormones? Although, granted, different stages of your life, you're designed to have less hormones. Certainly at the age of 40, I don't want to have hormones of a teenager. But at the same time, I shouldn't have hormones that are of that of a 80-year-old woman. So our body adjusts with this as we age. And so the more I started looking at it, and at first with the bioidentical hormones, I sort of put that to the side. And I thought, well, it's hard to know when you hear something is the best thing in the world to the worst thing in the world. And certainly my first motto is do no harm. So then when I had time and I started researching the bioidentical hormones, the first thing I did was look at the side effects. How is this negatively going to impact my patients? And if it is, I'm not spending any more time on it. And so the more that I read, the more that I realized as long as you treat them with respect and balance, they can be an awesome thing. And it's the type of hormone that we're using as well.
Right.
So I'm a firm believer in that as well. But then as time evolved, I started getting I'd get questions every now and then from patients. Well, if this is a normal process, menopause, talking about perimenopause, then why do we feel terrible when we go through that? I'm like, that's a good question, because not everybody does. And so then that's when you start peeling back more layers and you see it's been a buildup almost your entire life of whether it's inflammation, insulin resistance, stress causing adrenal fatigue that then causes your body to not be very good at adapting as our hormones start to slowly drop as we go through perimenopause and menopause. So instead of slowly dropping down to another good level, they just fall off the cliff. And you feel that too.
This is where a lot of the symptoms, hormonal symptoms, happen, whether it's being perimenopausal or premenopausal, because the heart of the tank at the menstrual cycle, usually the worse the symptomatology is. And so if those transition points aren't smooth and they're sharp angle, then the body's going to it doesn't have the time capacity to do the adapting with it. I know that you get to see a lot of women also take just really good control of their role that they play in helping support the body through this. So as you grew in your things, did you just start learning how it made you feel? Because you were on your journey and you start eating low inflammatory foods and noticed how you felt, and then that dumped you into the research of what's this, why is this, and here's the body process. Is that how that happened?
Exactly. Yes, I started seeing my own evolution in food. Back when we started learning about insulin resistance, well, I learned that was me. And this might help my thyroid in a little way. I mean, it was really early on. And so I started eating a low carbohydrate paleo type of diet at that point. And at that point, so many things took off in such a positive direction. For so many years, I thought I felt tired and bloated and just generally sort of meh all the time because of the long hours and the stress of studying and the working nights and days and that sort of thing well, yeah, that was part of it, but it was my diet of Mountain Dew and pizza and McDonald's and everything convenient because I felt like I didn't have time for that. And that maybe it didn't matter because I was hungry and it was 2:00 in the morning and I hadn't had anything since 5:00 that morning for breakfast. To realizing, wow, this is really important. Food is not just to satisfy hunger, it's to nourish and feed our body. And so with making that change and that transition, and several people around me had as well, you realize how much better you can feel. And I always tell people when they joke about, a few years ago when I turned 40 and they were still, not 40, oh, you're 40 now. I said, I felt better in my 30s than I did in my 20s. And I fully expect to feel better in my 40s than I did in my 20s.
That is exactly what I'm talking about. That makes my heart happy.
So then when you start reading more and more about that and just all of a sudden understanding and even just little tidbits of things. One thing that I read where it talked about, we were provided everything that we need to nourish our body. And you start researching how herbs can help you with inflammation And that's what we use to season our food with to make it taste better and exciting instead of putting sugar and table salt and everything. And you realize, well, gosh, that garlic that you put in everything, that's great for your belly and inflammation. And so that was exciting to see too, is that all of this stuff that we normally, or a lot of us should cook with every day, that gives food flavor, also helps us in a lot of ways too. So it's pretty exciting to see how that all blends together.
And so the switch can be easy to being you're used to having your sweetness or your saltiness, from your synthetic aspect of how bleached and stripped, and instead it starts flavoring your food with turmeric and garlic and things that are actually going to help the homeostatic balance of the body. And I think that that's one of the things that I hear from our patients, that how you teach them and you simplify it for them. That it's make it like this isn't hard. It takes consciousness. And I think that that's such an aspect that people they stop before they even get started, because they just think this is just too hard and I don't know what to do. But that's why we're here, to help guide and to help learn. And there's amazing books, and there's groups and people that you can get involved with, so that you can learn how to fuel yourself right, how to help with giving yourself what your body needs, and then having a team of wellness providers in your back pocket to help guide you, to help be your Sherpa, if you will. And I don't know where I'm using that name from, but I just sometimes the mountain thing probably made me think of it. But I think that that's one of the biggest things that is such an honor to be able to do, and that I love watching the people that I know that you take care of, and that taking full ownership of it, and really taking it and making it part of the reality on a day in and day out basis.
And I think a lot of times I like to impress upon people as well, because so many times this is a new way, a new lifestyle, new way of looking at food, is that, you may not get it perfect the first time, but that's okay. You pick yourself up and you get better and better. And the more you start feeling better, then you gain more momentum that way as well. And I can certainly understand when you're feeling terrible, it's really hard to be able to, make those healthy choices at first. And sugar is extremely addictive.
Horribly.
So the first thing I try to tell people is, for 2 weeks, just cut it out completely. Now you want to cut it out longer, except for an occasional, and you'll be able to get to the point where you can have something occasional, and it's not going to bother you one bit. Although it's a process of trying to get to that point, but you have to break that cycle. And if you can break that cycle, those first 2 weeks, it makes it much easier. Food tastes different. It tastes better. Sweet things taste sweeter. So that dessert that you may think that was the best thing in the world, after doing this, you may take a couple of bites and think that is so over the top sweet, and that's all you taste. And you start craving it less. And then if there's other things that are also driving those sugar cravings, and that's amazing to see. And one of those things is candida overgrowth in your GI tract, which honestly, if you would have told me that was an issue 15 years ago, I probably would have looked at you like you were crazy. But I change. And so I always tell people, if they, maybe they bring up a new idea, or listen to something for the first time, a new idea, may not think that maybe that's an idea that's quite the right approach, but I never completely and totally discount it, unless it's dangerous, of course. But when you see that you have an overgrowth of candida, which should normally be in your gut, it should be all over your body, just like bacteria in general. What feeds candida? Sugar. And so if you have those intense sugar cravings, and we're not talking if you see an Oreo on the break room table, you may look at it and think, that looks good, and you eat it, but it's more of I need it now. And if I don't have it in my pantry, I'm driving somewhere to pick it up. That intense sugar craving, there's something driving that. Whether it's you're hitting a crash because your blood sugar is dropping, you need something to boost your sugar and your cortisol and your energy, because your brain's not stupid. It knows what it needs for quick energy. Of course, it's not sustainable. Or some other GI pathogen or candida overgrowth. Once you conquer those, it's so amazing to see people don't have sugar cravings. And they think that is the weirdest thing. I don't have to have that sugar that I once thought I had, or what I once thought I needed. So it's pretty neat to see that. And a lot of times people will recognize that right away too. Or I'll ask them, well, do you still have the sugar cravings? And sometimes if they still do, then that's a sign of, okay, we have something more that we need to work on or we need to revisit too. But it's just, it's so fantastic to see people when they come back, and how many changes they're doing and how much better they feel, but yet to not stop. And I always tell my patients, don't settle for better, settle for best.
I think that is such a powerful statement, because we're trained to be like, oh, it's just like, this is my common headache. It's just my, to minimize us feeling bad. And you were talking about that just a few moments ago. And if we could really get to the point where we feel our absolute fullest, then life is easier. When we don't feel good, life is so much harder to get through. And when you give them the tools back, and then they start to implement it, and they're doing the work, because if we're ever going to really change the state of our healthcare and our world, it has to go back to the individual taking responsibility for their individual health, or if they are overseers of children, for their children's health, and to create the habits and the awareness around it, and then support it if it needs supported along the way, but not to just discount the stuff that it needs in terms of nutrition and slowing down and movement and things along those lines.
Exactly.
Well, thank you so much for coming on the show. This has been so awesome. We're going to have you come back, and we'll talk about something more specific where we can get down to like thyroid, hyper, hypo, or, talk about some solutions there. I would love to have you back. It's always a joy.
Oh, absolutely. I completely agree. And I would love to do it again.
Yay. Well, if you guys want to get a hold of Dr. Sally, we will have her contact information in the show notes, as well as when we post this on our social media accounts. And then obviously, if you're in our office, you can always have a card. We always have her information there. So thank you so much for listening, and join us on the next episode.
Hi guys, Dr. Arminta here. Thank you so much for listening. I hope today's episode brought you information to help you eat better, move better, think better, and take care of the true root of your health issues. You can find us online at achievebalancechiropractic.com/podcasts, and you can find us on social media as well. We look forward to having you here the next episode, and we look forward to helping you create a healthier future tomorrow.